بسم الله الرحمن الرحيم. السلام عليكم أعزائي الطلبة. اليوم المحاضرة مال cerebellum, the pons and the medulla oblongata. We start the first slide by looking at the blood supply of this area. We are going to start from the heart, which is on the left side, of course, and the aorta is emerging from the left side by this arch, the arch of aorta, and it continues, of course, to the descending aorta, the descending part of the arch of the aorta. There is a trunk on the left side which is not present on the right side. This trunk is the brachiocephalic trunk, which gives rise to the subclavian artery and the common carotid artery, while on the right side the common carotid artery and the subclavian artery are coming directly from the arch of the aorta. The subclavian artery will go to be the axillary artery, and then into the upper arm to be the brachial artery. This is just to refresh your minds about the continuation of this artery. The other artery, which is the common carotid artery, of course it is lying in the neck. It is part of the structures which are lying in the carotid sheath. It divides into an external and an internal branches, which are the carotid arteries, external carotid artery and the internal carotid artery. The internal carotid artery will enter the skull and will give rise to anastomosis with this important artery, which we are going to follow from below. The continuation of the internal carotid artery is into the anterior cerebral artery, which goes to supply the cerebral hemispheres. This is a communicating branch with this is the left with the right anterior cerebral arteries. We are going to go now to this branch, which is the subclavian artery. The subclavian artery, among the branches which it gives, it is giving this branch which ascends. It is the vertebral artery. You can read it there. It is the vertebral artery. This vertebral artery ascends in the neck, in the posterior part of the neck. It is going through the transverse processes of the vertebrae of the neck, and then it has a curve before it enters the skull from the posterior surface. This was the anterior surface, the anterior part of the skull, entering through the anterior part of the skull, or on the anterior part, because it is not the anterior part of the skull, but it is the anterior part related. When we are looking at the posterior part of the skull, this artery is the vertebral artery enters into the foramen magnum to enter what? To enter into the skull. This is the left vertebral, and this is the right vertebral artery. They join each other on a bone known as the clevius. We are going to see it in the coming slides, it is the main supply of this region, of the structures in the posterior cranial fossa. Of course, you can see that these two vertebral arteries give branch to unite and form the anterior spinal artery. The anterior spinal artery, which is going to supply the spinal cord in the cervical, mainly in the cervical area. We are talking now about the cervical area. In this area, this is the basilar artery. The basilar artery is the main artery lying between the pons and the clevius, and giving rise to these branches, which are going to supply the midbrain. The midbrain, if you remember your midbrain, which is the thalamus, hypothalamus, pons, medulla oblongata. These are the structures below the tentorium part of the structures that divide and hold the brain tissue, which is soft and needs something to hold it. The dura act as the skeleton to hold the brain and its structures inside the skull and outside, of course.